Hello and welcome to the Queen's Couch Podcast with our amazing host, Dr. Tanika Victoria. She curates a space for women where all women are encouraged to collaborate and do not collide. Join us on the couch tonight. Hello, thank you, and welcome to our episode of the Queen's Couch on tonight. I am excited about our topic for today, and we are going to be talking about Black maternal health. Did you know that it is Black Maternal Health Week? And so, as a woman of color, I would have to talk about this subject. I would have to have amazing expert with me today. And so, let's get into it. I'm going to tell you about our special guest, and then we're going to get into this conversation all about Black maternal health, doulas, midwives, and you can ask your questions. I am excited. So tonight we have our public health expert, Kayla Bolden. Kayla Bolden is a public health analyst at the CDC and a program director for Patients Are Waiting for their diversifying doula incentives. So we're excited about that tonight. She attended Agnes Scott College and received her BA in Public Health and Psychology in 2018, and later in 2022 she received her master's in public health with a concentration in health equity from Mercer University. Kayla is passionate about maternal health, and we are going to celebrate this episode of Black Maternal Week with this amazing activist in her community fighting for Black women's health. So we welcome Kayla Bolden to our couch tonight. Hello, Kayla. How are you tonight?
I'm good. How are you? Happy Black Maternal Health Week and happy National Black Doula Day. It's a great day to kick off Black Maternal Health Week.
Yes, it is. And so when I think about Black maternal health, I think about Black women are three times likely to die of a maternal health issue than any other woman in this country, which is alarming, which makes me think as a woman, and just to kind of share with the women on my platform, even if you're past the age of having children, but you have daughters, you have nieces that you want to advocate for. And so this is why this topic is so important, that we advocate for Black women, that we advocate for women of color. And so the work that you're doing is amazing. Our quote for the night is, we are letting women, especially Black women, die needlessly. And so when you hear that, what do you think? And what are your thoughts about that?
Um, what I first think is, Black women in the United States disproportionately experience adverse and negative maternal health outcomes, such as maternal morbidity and mortality, higher rates of postpartum depression compared to other racial and ethnic groups. Um, Historically, due to racism, modern day racism, structural racism, institutionalized and systemic racism, and of course, these disproportionate rates became higher with maternal health outcomes during the COVID-19 pandemic. Existing racial disparities worsened for Black maternal health due to COVID-19. And it is important to acknowledge this issue just because, one, it lets us look at the effects of racism on our society in the long term, and especially on Black people's health. Our lived experiences have long lasting effects on our health when I think about it.
It does, it really does. And when I think about even being a mother when you have children young and you don't even know that you're experiencing postpartum, the no information, not being educated, not being knowledgeable of the things that Black women experience at a great at a larger propensity than other groups, especially in the United States. It's really something that we need to dive into. And so I have a few questions for you tonight. I always ask people their why. Sometimes it's that aha moment that makes you think, why do I want to advocate for Black women's um, maternal health? Like, was it this aha moment? What was that story like? What made you say, this is my cause? I'm going to fight for justice. What is it going to be like?
I think just one day I sat down and I thought, I want to live in a world where people who look like me aren't afraid to get pregnant because they're worried about dying. This was my year a few years ago when I became of childbearing age, according to my OBGYN. And actually, last year, the Washington Post did an article that stated for some Black women and Black birthing people, um, they feel that the fear of death shadows the joy of birth. And when I read this, I automatically thought of the documentary on Hulu, Aftershock, which I highly recommend you all watch. Um, and we have a lot of women and birthing people in our history that have faced hardship in their reproductive health and birthing experience. And it's time to uplift those people and their families and do our best to prevent these experiences from happening again. I eventually want to go into maternal health policy because during my master's, I realized nothing gets done without policy implementation and change. I have connected with the Pennsylvania Doula Commission, and I am working here in Georgia to see how Medicaid can officially be expanded to cover perinatal services up and down the East Coast.
Awesome. That is amazing. And, when I think about that, everyone talks about doulas. And so, for our guests, some may know what a doula is and some may not. So, can you define a doula and what is a midwife, and how can they help in your birthing process?
So, a doula is a non medical professional that provides support to the birthing person and their family. They help with things such as birth plans, attending your birth, postpartum. Some of them even go above and beyond and help you get on government assistance after you give birth, such as WIC and food stamps. So, they handle all of the social or economic factors of support that are non medical in terms of your birth. They help you do your registry. They might even help with your baby shower, but they essentially are there to provide the birthing person and their family with that emotional support and that physical support that medical professionals just can't do because they're tending to medical procedures during your birth. And some doulas are full scope doulas, some doulas are just birth doulas, some doulas are just postpartum doulas. We even have some abortion doulas around the world. So a doula can help with essentially any aspect of birth. We even have some bereavement doulas or afterlife doulas if the mother happens to die after childbirth. So a doula is catered to support the birthing person and the family in any way outside of a medical environment. And for a midwife is a medical professional. It takes 4 years of nursing school and 2 years of midwifery school to become a midwife. So they are the medical assistant, and they're similar to a nurse that would be in the delivery room with you. So those are the essential differences between a doula and a midwife. One is medical and one is non-medical.
Okay, awesome. I just wanted to clear that up just because to know that, a lot of times individuals want to have home births. I just was actually having a talk with someone last night and they said they wanted to have a home birth, but they were afraid.
Mhm.
And so one of the things about that, um, how safe is a home birth? And how can we as women of color break the stigma of having home births as just being this taboo thing?
Um, So, home births are completely safe. Knowing my history as a Black woman, we did home births before we were pushed into the hospitals. Slavery and being in Africa, we had granny midwives, and granny midwives came over from Africa to America, and most slaves gave birth at home due to these granny midwives. And then, medical associations kind of modernized midwifery and made it so where it was regulated and you had to do 6 years of school to become a midwife, and it kind of pushed all the granny midwives out the way so they couldn't do their methods that were brought over here from Africa. And now only 5% of midwives in the United States are African American. So for those who think midwifery is not safe, or think that home births are not safe and they're very fearful, I would just recommend, talk to your doctor, talk to people who you trust. If you know someone that's had a home birth, talk to them. Um, Maybe even have a doula consultant session or a midwife consulting session discussing what are those fears. Those fears could be something internal that you have due to past trauma, or they could do with some medical history of your family. So it really just depends. But I also want Black women and Black birthing people essentially to remember that historically, we always gave birth at home and we were okay. So we did it once before and we can do it again now.
Also, thank you for sharing that because I really want to. Of course, I didn't experience a home birth, and I probably won't at this age now. I'm about to be 49, but I do know a lot more women are having home births, and just I think it's just a great experience to be at home in your own environment, and having the tools and the capabilities to do that. So, how expensive is a doula?
It depends on where you live, but right now a doula can range from $800 to $2,500. Here in Georgia, the average cost of a doula is on the higher side, about $2,000, and that's for full perinatal care. So that includes, they give you 2 prenatal visits, they assist with your birth, and they give you about 2 to 3 postpartum visits. However, if you just want a doula for your birth or you just want a doula for postpartum, those prices can range between 500 to $1,200.
Okay, so basically not um a lot at all. I think I have someone in the chat that says, "What would be a recommendation for someone that has hypertension um, when they're doing a home birth? Should they kind of clear that with their doctor, or would you
Mhm.
suggest one of these doula consultation sessions?"
Yeah, if you already know that you have hypertension, because I know hypertension can be a side effect of birth, but if you've already been diagnosed with hypertension, of course, talk to your doctor, talk to your midwife if you have a midwife doing your home birth, and just come up with your birth plan. Your birth plan is really important, and doulas, they are amazing when it comes to birth plans. No question is unasked. No, no thought is just unthought of, really. So I would just suggest obviously talk to your medical professionals. And if you already have a doula, definitely talk to what you guys can do about your birth plan. Now, if you only have a doula at your birth and a midwife is not present, a doula cannot give you any medical advice. So if something medical does happen and a medical professional is not there, a doula legally and to protect themselves would not be able to help you in any medical standpoint. And from that point on, it would probably be written in your birth plan that if anything happens, you guys got to be moved to the hospital.
Okay. So does some insurance covers doula, or this is an out of pocket expense only?
Depending on where you live, again, some states right now, we have 8 states in the US that have Medicaid expansion that cover perinatal doula services, Pennsylvania being one of them. So in the state of Pennsylvania, Medicaid, if you're on Medicaid, that covers doula services. Last year in the state of Georgia, Medicaid was expanded to cover perinatal doula care. However, it took a halt this year because um, in order for these things to continue, there has to be enough doulas and in enough areas to provide the care. And in Georgia specifically, when we expanded Medicaid for perinatal doula care, everyone who took advantage of those services were either in more urban areas like Atlanta or Savannah. And there are 79 counties in the state of Georgia that don't have a maternal unit or some type of maternal care access to them. So they might have to go to the next county over to receive their maternal care. So Georgia outside of its big cities is very rural, and that's what we're working to do is, to increase the number of doulas in the perinatal workforce, but also just get people access to facilities where they don't have to drive an hour or maybe 2 hours to get their maternal health care.
That is awesome. So, if someone heard you tonight and they said, "You know what? I really am passionate about this. How can I help?" So, what are ways that we can help to drive this cause of in those areas where there deserts, where there's not doulas, there is not maternity care in the way that it should be in more, um, urban areas, bigger cities? What is something that we can do to help push this cause?
Well, first, I would recommend, know your history. I can't say that enough. Um, just know that from maternal health, it took us a long time to get to where we are. I suggest all of you go Google who the mothers of gynecology are after this. Lucy, Betsy, and Anarcha. They have sacrificed their bodies for everything we have in maternal health today. Um, and, just knowing your rights, if you are a birthing person of color or even part of a family who has a birthing person, join support groups who advocate for reproductive justice and Black maternal health. Keep up with policies in your area. Go to political events. That's where we get most of our information and where we know change is going to happen. But just to start off easy, evaluate your concerns in terms of Black maternal health. Ask yourself what are your concerns and research ways and ideas that you can address them. If you even reach 1, 10, a million people, but as long as you can impact one person, everything else begins to spread, in my opinion. And most importantly, listen to one another in your community, share resources. We should never have to go through something like this alone.
That is so true. I think on last Saturday here in Columbia, they had a maternal health fair. And so at that fair, they had this talk where it was called the Mother Suite, and they had an opportunity to just kind of share about maternal health, about doulas. And so they're making a few strides in this state. There's some people that's really advocating for doulas and just the importance of Black maternal health. And so that's what really sparked me as I thought about this topic. I really dove in and tried to find out what was going on in South Carolina. What are some things that I can do when I think about, hey, my nieces, my daughter, they're gonna have a baby. What? How can I advocate for them if I need to? What do I need to know? And so that made me just start thinking and reading and just thinking about it because as I think about my own career, things can happen at the birth time or even in prenatal that can affect the child for the rest of their lives. And when you have good prenatal care, you just set the child up for so much success. There's things that have happened in childbirth where children have now birth defects, different things because they didn't even receive the proper prenatal care. And so just receiving that care and being able to advocate is so amazing. I am so proud of the work that you're doing. When I think about it, when I look and I think of someone who's so young and so passionate about fighting for the justice because they want to live in a world where people look just like them can have the capacity to say, you know what, I have control of my rights when I get ready to give birth. I have the right people in places and I can ask questions without feeling fearful because I think that's one of the things that happens with women, men, just women of color, men, just our race in general. We're afraid to ask questions when we go to the doctor.
Mm-hmm.
And so sometimes that causes things to happen. I was thinking recently, I know you saw the story of the young lady that was misdiagnosed, and the doctor told her she had a tumor, but
Mm-hmm.
she really had cancer, and
Yeah.
she died and left her children here. I
Mm-hmm.
mean, that was just really, I couldn't believe that I knew that this had to be a doctor who just kind of prejudged this young lady, didn't do their due diligence because there's no way you can mistake a tumor for cancer. There's possibly no way. So what was your thoughts about that? What 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 were your thoughts? Were you outraged? Were you upset? Were you like, what in the world is going on here?
It's interesting to say I've been in this maternal health world for a long time, so it was very disheartening and upsetting, but to me, it was not shocking knowing what I know. For a long time, there has been a disconnect between doctors and patients, as well as doctors and other healthcare professionals who are considered, non medical or non essential. And, my personal goal is to bridge that gap between OBs, midwives, doulas, patients. But essentially, it goes back to what I said earlier just listen, listening to your patient. I know it's easier said than done. And if someone's not listening to you, know your rights, find your voice, request someone else, request a new doctor. If someone is not listening to you or, is giving you microaggressions and thinking your pain or your experiences are not valid, always ask for someone and always document and make sure, whatever facility you're in or whoever you're talking to documents that as well. Like, I am requesting a new physician because you are not listening because of to X, Y, and Z that I'm explaining to you. Those are ways that we have to protect ourselves. And it's even crazy to say that we have to do all of these to protect ourselves in the medical field, in medical care of doctors. But I always even say, it's not even the care that you get, but who is doing the care that also matters. Black women and Black people in general, they always feel more comfortable with a doctor that looks like them. It can even go farther. Like, I prefer doctors who are Black and from the South. So they just understand that Southern culture is a little different than Northern culture, or even if you live in rural areas, they understand the barriers of that. So be mindful of who you are choosing to provide you with your care. I know it's easier said than done when you go to an office and they just give you a physician, but I definitely recommend, if you have the time and if you have the resources, to, you know, look up who's in your area, what doctors are fit for you, just how we like to shop for a new bag, shop for new doctors. I do it all the time. So that's how I felt about the situation. I know that we as patients have to do more work on our end to protect ourselves, but that's how it's got to be until we can implement change.
I think so. You have to advocate for yourself. I have the same doctor for a very long time. And believe it or not, my doctor doesn't look like me, but my doctor is Southern. And I remember why I got a new doctor is I was before I had them taken care of. I had fibroids really bad, and I would be in pain. And I went to the doctor. And I was like, I'm in pain. I'm having fibroids. And my doctor told me, well, I have cramps every month too. So I looked really hard, and I had to calm down.
Hmm.
But she wasn't my doctor anymore.
Yes, of
And
course.
I was like, what? I just didn't, I couldn't be like, that's not what I'm in here for. That's not what I'm paying for my insurance for, that paying for this service for you to tell me about your issues and situations. And so I had to shop. And the reason I shopped is because before you go into his office, before you go in the examining room, you go to his office, you talk to him, you have your exam, then he brings me back out and talk to me again.
Hmm.
And everything that happens, because I've had to have some procedures, he talks me through everything. And so that's kind of why I've kept him. I've had him since now it's 2024. I've had him since about 2008. And even when I moved to Greenville, I got a different doctor and I wasn't comfortable with them. I got a second opinion because they were about to make me have a surgery that I didn't even need. And he was like, you don't need this. So it's very important to advocate for yourself. It's very important to find a doctor that's going to care for you. As you said, sometimes you want a doctor that looks just like you, but you want someone to understand you, your region, your culture, your story, and everything about you. Because sometimes my favorite saying is, sometimes your skin folks is not your kin folks. So you got to find your kin folks, your real kin folks, your real village that understands your story, your fear. Because I had an aunt to die of cervical cancer. I've had an aunt to have breast cancer. So I'm overly sensitive when those things happen. When I go to the doctor, I'm already on high alert, like if anything goes wrong. So I need my doctor to understand that and not just brush me off as another patient. And so advocating is very important, as you said. One of the questions I want to ask you, tell us about um, your doula program and how you're diversifying doulas and what's that's like. How's this journey been? I've heard about it so many times, but now I want the world to hear about this program and when did you start it? Why did you start it? And how did this took off?
So, my mentors, who I thank every day, they're awesome OBGYNs in the delivery room almost every day. Dr. Sharice Hamblin and Dr. Cherie Livingston, they are based out of Lancaster, Pennsylvania, which is a small rural town, and it's the Amish capital of the country, and it is the home birth capital of the country. But it's crazy to say that, especially my mentor, Dr. Livingston, she is the only Black OB in her hospital, which I think is amazing in itself. So, Patients Are Waiting is a nonprofit organization that they founded that is dedicated to eliminating health disparities. And currently, as I get more busy and as I start to move towards policy and advocacy, I serve as the program director of their Diversifying Doulas initiative. And our goal is to address maternal morbidity and mortality by increasing the number of doulas in the perinatal workforce, providing subsidized doula care to low income birthing people of color, and to conduct research on our program's maternal health outcomes. And to date, we have trained 38 doulas. We actually just trained 10 doulas last weekend, which is amazing. And we have served over 290 families in the rural town of Pennsylvania since being founded in 2020. So our program is Pennsylvania based, but we're rapidly growing. We're trying to expand to Massachusetts right now and all up and down the East Coast. And again, that's what comes back to the PA Doula Commission, and we're working with them because we want more doulas to be trained through the PA Doula Commission. That way they can be reimbursed through Medicaid. And once Medicaid sees that we have doulas dispersed throughout Pennsylvania, not just Philadelphia or Pittsburgh, but more rural areas, that gives us more leverage to pass it into law.
Awesome. So how easy is it to become a doula? How long is the training? What what type of person should become a doula? Let's start there. What type of person? What characteristics you should have to
Mhm.
be a doula?
I always say to be a doula, you have to love birth and the birthing experience and just helping birthing people, especially birthing people of color, have um, a non-traumatic birth experience. Um, and our program, it essentially is 2 months to become a doula. It's a 8-week course. It's one day a week, uh, 2 hours each week, and then we do a hands-on weekend where you essentially practiced everything you learned in the classroom with your instructor. That way you'll just be more comfortable with creating a birth plan, talking to a patient, interacting with doctors. So when we did our hands-on weekend last weekend, actually we had anesthesiologists come in and practice with our doulas. We had of course our mentors, the OBs, come in and practice with our doulas. um, and we had some people come in and role play just as patients interacting with a doula for a first time, just so they can get comfortable with that first interaction. And of course, the postpartum period as well. There's got to be a postpartum plan. So that hands on weekend is really to get them acclimated and get them some in field experience before we put them out in the field. So through my program, it takes 8 weeks. Some people can be trained in a weekend. It just depends on what type of doula you want to be, what type of care you want to provide. So some people, they just want to be a postpartum doula. That takes a day. It's just one class for 8 hours. So it just all depends on the type of doula you want to become.
Okay. So that sums it up. So if you would like to be a doula, 8 weeks and hands-on training. And so I know you talk a lot about the Black Doula Association. Um, so tell me about the Black Doula Association and how important it is to have a Black Doula Association versus just our regular doula association.
Yeah, so the National Black Doula Association, NBDA, my program worked with them for a long time. They provide very good doula training and certification, and they're one of the biggest doula certifying bodies. I think they're right under DONA, which is Doulas of North America, which is also a great organization. The instructor that we had do our hands-on weekend, Nakia Lawson, she's an international trainer from DONA, so she trains doulas from Dubai to America, and she's amazing. But for Black women and Black birthing people, it just goes back to Black people feeling more comfortable interacting with people who look like them or even who have experienced what they've experienced. I know when my time comes to have children, I know I probably want a Black doula who has also had children or a Black doula who has had children while having PCOS. So those are the little questions I think about when, again, you go shopping for doulas. Does experience matter most to you? Does just having a doula in general matter most to you? But I think it's important to uplift people who look like us and who are passionate about serving us specifically. And I think that's very important.
That is very important. And so as I think about it, you're saying you need to definitely shop for your doulas, shop for your doctors, just shop in general. So you did touch on it a little bit. I always have a question. What type of doula would you like? So you already told us the type of doula you would like. So would you have a midwife at your birth?
Yeah, so I think I want to give birth at home right now. If I had to decide today, I'd give birth at home, and I would need a doula because I would need a doula because that is the physical and emotional support and well-being for me, and I would need a midwife just because that is the medical professional there, and I think having the medical professional there just prevents you or prolongs you from having to go to the hospital, because I don't think most people know, but you don't have to go to the hospital at all. I know some people think even after you give birth at home, you still got to go to the hospital and fill out some paperwork, but that's what your doula is there for. You do all that paperwork before you give birth, birth certificate and everything. That can be handled online, but if you do not wish to go to the hospital, you never have to go to a hospital. So I do want to emphasize that because I had a few people ask me that this week.
So as I was diving in, I'm currently working on this mental health and wellness fourth degree. So here we go. But I did a research last week on postpartum and postpartum psychosis, and one of the things they talk about is the 3-3-3. So do you have any rules for doula care similar to that? So it's like 3 weeks you are on the bed, then 3 weeks you're beside the bed, and then 3 weeks, you know, you're doing something else. So what are some aftercare things that would the doula be there through that whole process if you decided to do that or not?
It depends on the doula, but we suggest at least stay with the client 8 weeks. I know in the OB world, it's like postpartum is considered 6 weeks, but definitely that 8 week to 16 week mark is so important. And some doulas go above and beyond and follow their client to 6 months, which is amazing. It just depends on what you need and what you and your doula come up with. Most doulas that I see in Atlanta, they do between that 8 week to 16 week period because um, after the baby's first born, the high that I call it, the high kind of goes down. Like grandma might not be home anymore to help. Uh, Partners going back to work. Your social circle may have gotten over the excitement that you had a baby, and that 8 to 16 week mark is really when you're going to need your doula, in my opinion.
Okay, awesome. That is some great information just to know that it is a high. Everybody wants to see the baby. Oh, you just had a baby, but there's a lot of things that happen after you have a baby. Experiencing postpartum. There's so many women that experience postpartum, and a lot of them don't even know. Um, I experienced postpartum, but I don't think I knew until I it was over. I just didn't know what was wrong, and then as I did research, as I became educated, I was like, oh, what's happened? Oh, this is what happened. But you didn't know because in rural areas, no
Yes.
one's there, as you said, to tell you about the things. And you live in a rural area. The hospital is about a 30-mile drive. So imagine if you're in distress. So you're deciding whether you're going in a little small town I grew up in. You're deciding whether you're going all the way to Savannah, which is about a 45-minute drive, or you're going to Beaufort, which is another 40-minute drive. So when you're that adrenaline driving, trying to figure out all these things, that can be a big issue for people in rural areas. And I see the importance of making sure you're reaching out to rural areas because could you imagine you're having a complication and you have to drive all the way 30, 40 miles just to get to the next place where you could also decided, hey, I'm going to have this midwife here. I'm going to have someone to be able to take care of me, to be able to support me, to be able to answer my questions, to be there for me, because it's a fearful time, even though it's a exciting time. You're afraid. You're like, what is it going to be like? What's going to happen? Everyone's story is different, and having that person beside you. This is my first time even hearing about a birthing plan in my life tonight. And here I am, 48 years old. I've never heard that I mean, I know you need to plan for the baby in general, but
Mhm.
literally sitting down and saying, I know who I want in my room. I know what I want to happen next. I've never ever heard of that, or even thought about having that until tonight, when you said how
Yeah.
important it is to have a birthing plan. And there's probably several women who've never heard that. Oh, I need to have a birthing plan, and I can have a birthing plan, and this is my right, because they don't know that it's their right. And so
Mhm.
I'm really glad that you shared that on tonight. And of course, I'm definitely going to tell people, what is your birthing plan? Do you have a plan? You know,
Mhm.
that is something that, if no one takes anything from this conversation tonight, make sure you advocate for yourself. And as Kayla said, get you a birthing plan in place, just in case something happens. You already know what is supposed to happen. So as we wrap up tonight, I want you to tell us what's next for Kayla.
Uh, what's next? I'm just gonna continue doing what I'm doing. I my team presented in Canada on some research we did. So I definitely see more research in my future. I've been going to more maternal health conferences. I in February I go to the Lucy, Betsy, and Anarcha, or the Mothers of Gynecology Day of Reckoning conference, and like I'll plug them again. Please look up the Mothers of Gynecology after this.
I'm gonna look her up tonight.
Yes. And I have some conferences coming up in September for maternal health, October, and I'm just going to be presenting what I do, presenting what I plan to do, and hopefully, Pennsylvania will have Medicaid expansion for perinatal care within the next 2 or 3 years. People say, well, 2 to 3 years, but it takes a long time to get policy passed. But once people see that policy works and this change is vital, I think it'll come more seamless. And we're already fighting up against a lot of bans for women's bodily autonomy. So it's kind of been push and pull for the past year. So I'm hoping to see some change as we move forward.
That is awesome. And so I definitely want to thank you. On the Queen's Couch, we always collaborate. We always have amazing guests. And so I want to thank you for being my special guest tonight. And as I always tell you, I'm so proud of the work that you're doing. It's amazing. It's inspiring to be able to help someone and make an impact in someone's life, that can be the change between you having a great, awesome birth than it being a traumatic experience. And people don't understand that. I remember growing up, and my grandma used to say, when you have a baby, it's one foot in the grave and one out. And I'm like, yeah, right. But now when I think about um, the proportionate number that women of color have these issues, even though it was a wives' tale or it was a saying, but it really is the truth, that you really have to take care of yourself. So, do you have any parting words for us on tonight? Anything you want to share? I have a lot of comments. They're saying this has been a great conversation tonight. They thank you so much. Someone says they're going to look up a doula right now. They're ready to have a baby.
Yes,
I'm
of
like,
course.
okay.
Yes. I parting words for tonight. I just every time I speak, I hope you learned something, and I hope my words spoke with you. So if my words spoke with you, that is a real win for me tonight. And if you have any questions for me, or if you have any doula questions for me, feel free to follow me. I'm the underscore golden underscore K on Instagram. I'm also on LinkedIn, but please flood your doula questions or any questions, or if you're in the Atlanta area or Georgia area or in the Pennsylvania area, um, and you need a doula and you're a person of color, please let me know and we can help you in tremendous ways.
Somebody said you was amazing, Soror.
Yes. Hi, Sor. How are you?
Awesome. So thank you so much, Kayla. It has been such a pleasure to have you on the Queen's Couch tonight. I think this probably is going out of all of my um episode. This has been the most special to have you on here tonight. And I appreciate everything that you've done. Just amazing work. You're such an amazing, talented, gifted woman. And so I'm excited about what's next for you. I'm excited that you were on the Queen's Couch tonight. And so definitely don't forget to flood Kayla's. If you have questions, find her on LinkedIn and also on Instagram. And so I'll drop her handles they're also in the description. If you're in the replay, you will see her descriptions at the bottom. So thank you so much. You have been on the Queen's Couch tonight. And guess what? The Queen's Couch is a place where people collaborate and do not collide. So thank you for being on the couch tonight, Kayla. Have an amazing, amazing night. Thank you so much for joining us tonight. And we will see you next Thursday with my special guest, Miss Karen Jenkins, as we talk about Black women in business. So thank you so much. Have a great night. Hello and welcome to the Queen's Couch podcast with our amazing host, Dr. Tanika Victoria. She curates a space for women where all women are encouraged to collaborate and do not collide. Join us on the couch tonight.